CLL is a chronic lymphocytic leukemia. It's a serious form of blood cancer, but it doesn't always need treatment straight away. And although most people do eventually go on and need treatment, not everyone does. A lot of my patients have CLL. When they first come to me, they each have a unique story, and the journey of diagnosis can sometimes be quite long. In fact, most people with CLL come to me as an incidental finding. They'll often go to their GP for something, and they'll have a blood test, and it'll pick up an abnormality. The diagnosis of CLL can sometimes really come out of the blue. It causes a great deal of anxiety and uncertainty, and it's very, very frightening for people. You might be worried about how this might affect your life. Will I die from this condition? What's going to happen to my family? Do I have to leave work? When patients don't need treatment straight away, we need to go through a process of monitoring how they are. Active monitoring starts with active listening, because the whole active monitoring process is about that mutual understanding of the impact of a disease on an individual. They were a person yesterday and they're a patient today, but they're still a person. Who is that person? Community is a big part of the support for our patients. So developing that sense of community within the CLL space is something that our patients will often really benefit from. It's so important that patients have good information to take away with them. We have booklets that we can give. We can signpost to patient organizations. We can signpost to websites that give good, valuable, trusted information. The call to action document is a really valuable resource. It's a great tool. We came together to discuss issues that we thought would be really important for our patients at this early time of diagnosis. And we ended up focusing on 3 key areas around communication, around access to trustworthy information, and building a community of support around our patients. And this is a document that provides some very valuable and useful practical tools, practical skills for healthcare providers, but also pointers for our patients to really empower our patients during that time of active monitoring.